have noon, and we will call the Human Services Committee meeting to order. First item on the agenda is approval of the agenda. Chair will entertain a motion.
I'll move that.
Thank you, Commissioner Snell. Thank you, Commissioner Williams, for support. Any discussion with respect to the agenda? Hearing no comments, all those in favor will please say aye.
Aye.
Any opposed? Thank you. We're now up to item 3, public comment. Any public comment today? I recognize the folks in the audience, not too much in the way of public comment. Any public comment at all? Public comment is now closed. We'll move on now to committee items. Item 4A is minutes of our previous meeting. Chair will entertain a motion.
I'll move those.
Thank you, Commissioner Snell. Thank you, Commissioner Williams. Any comments with respect to last month's minutes? Hearing none. All those in favor of approving the minutes will please say aye.
Aye.
Any opposed? Thank you. They stand approved. We're now to item 4B, appointments. We have an opening on the Department on Aging Advisory Council. It's a public seat currently held by Felicia Richmond. We have had as yet no applicants. Are there any nominations from the floor? Hearing no nominations from the floor, we will advertise, and I would ask committee members that if you have any friends with an interest, this is a public seat, doesn't appear to have any particular qualifications like being from any particular constituency. Please suggest those for next month's consideration. We come now to the Department on Aging monthly report. I see Danielle. Thank you, Danielle, for being here today.
Good afternoon. For this month's report, I just kind of wanted to highlight the Meals on Wheels program and kind of do a little comparison from year to year. I think that's always interesting to look at. And as looking at the number of meals that were provided, you can look at 2020 and see the increase that we had from 2019. Again, a lot of that is pandemic related, and the number of people that saw the need for the Meals on Wheels to be brought into their home, worried about going to stores and things like that. And then also they opened up the eligibility, changing the clarification of a homebound status of a senior. Currently, that is still the case. We are seeing a decrease in the number of meals that are being provided, but they still have not changed the eligibility criteria to reflect that homebound status. I anticipate that'll probably change sometime this year, so we'll be looking at that, and then we'll probably see another decrease in the Meals on Wheels eligibility at that time, and the number of clients receiving the service. There was about a 35,000 meal variance if you looked from 2020 to 2021. With that, the biggest change that I noticed looking at the contracted meals, so with our contracted meals, that's related to the service that we provide with Tomei Pace and also with Region 2 through the Medicaid waiver. That's where we saw like a decrease related to the number of meals that were able to be delivered to the Tomei Pace site. And that's also going to be represented in the client numbers. So what I anticipate is that on our congregate side, as Tomei Pace has opened up their site and are allowing seniors back in and providing activities and nutrition on site, we'll see an increase on our congregate side. I don't know if we'll see an increase with the Medicaid waiver with Region 2, as they were able to have the providers that do community living services in the home. That person can also prepare meals, so we'll see like a decrease in the number of meals there if they're able to have that person prepare meals in the home. With our grant clients in that second chart, you'll notice that there wasn't a huge change from 2020 to 2021, and part of that can be related to the fact that when people get on Meals on Wheels, they may receive that like post-hospital, they may need it for a brief period, so it's not like when somebody's on the program, they're on it for the full year. People kind of come on and off as they see a need for them health-wise or Sometimes there's changes in living situations, maybe a family member's moved in and is helping that senior, so we may see a decrease in clients or an added support there as well. So we're kind of always watching the numbers and trying to project out where we'll be. I kind of have been flagged where we were at from 21 in January to where we were at in 22 this year, January, and I thought I'd see a little bit of a decrease there, but we were about 1,000 males higher from 21 for the month of January for the month of 2022. So we'll just kind of monitor those numbers and see where we're at, but that could also be related to people being a little bit nervous with different variants that are out there for the COVID. With our grant donations, I think it's good to see that in 2021, we actually went up from 2019 as well as in 2020 to like 39 cents per meal for the grant meals that were put out into the community. So, I think it's the community being generous for a service that they're able to contribute back towards, so we're very appreciative of those donations. Any questions on those charts? Okay, thank you. I also did some different attachments with the report. We're working again with the Vita income tax program. They started last week at the center, and of course then we had the snow day, so they lost their Wednesday day of service. But we're, again, that whole site, which is a great opportunity, again, for us as an agency in the community, where people that are using that service, they get a chance to learn about the Department on Aging, see the senior activities that are going on, maybe stay for lunch that day if they're there for a morning appointment. So we're definitely trying to highlight our different programs that we have available that people can check out. Again, it's a good opportunity for us to highlight, the things that we're good at. So. The other attachment with my report was on the focus group from Region 2 Agency on Aging. That'll be in March 15th. And definitely if people want to come and check that out, they can participate in that focus group. Within that flyer that's in your report, you can actually click on the link if you're not able.
Just a second, Danielle. Gentlemen, can you take your discussion behind the wall, maybe? Thank you.
Okay, thank you. So with that focus group on that flyer, if you click on the link for Region 2, it'll actually take you to the survey. So you can actually take that survey yourselves and offer some feedback as they're looking to get some community input. We are handing out the surveys right now. It's a big survey packet. There's like about 60 questions in it. So those went out to all of our home delivered meal clients, so they get an opportunity to provide some feedback. We're sending that out with our home care clients. We're sending it to our congregate site. So as much input that we can get from caregivers and from seniors or anybody in general in the community that'll help them as they think about their area plan and what the needs are as they move forward as an agency, which then also helps us too. With our Soups On for Seniors event, that's going strong in the planning phases. So we've raised about $9,000 so far, and that's in between sponsorships and some of the ticket sales, and we're gathering silent auction items, so that is going full force. I included the link to the website, so you can also you can check out our sponsor list, our restaurants that'll be participating so far this year. We're looking for a couple more if anybody's interested, and we're reaching out to a couple other restaurants as well. So I also included some activity pictures. Again, I think I'd just like to highlight, the things that we're doing for seniors in the community. Definitely in the winter, you can see we're doing some different cornhole tournaments. We have, has been brought back. We haven't done that in a little while, but the seniors are enjoying the bowling activities and things like that. Our square dance group is back at the Department on Aging as well, and I just highlighted one of the craft pictures that they're doing. So again, fun and excitement at the centers. Any questions?
Questions for the Department on Aging? I would simply note that Vita is important, and quite often those of low income have fully as complicated tax situations as those of higher income. So they need help, and especially this year it's even more complicated with child tax credit rebates and earned income credits and economic incentive payments and all those sort of things that have come out. So not only is our tax system designed to collect revenue, it's also designed to disseminate revenue, and so it's important work to do.
I think it's a great opportunity for us to be that whole site, because I think that we're known to seniors to be a safe place for them to go. So if they have questions, they feel safe coming to our building. They, again, I think that safety factor is important, and just feeling like people there are knowledgeable, and they can, if they have other questions that come up, you know, they might be there for taxes, but maybe they have another question about services that can help support them. So
It's a good thing to do, so thank you for doing it. Anything else? Okay, thanks, Danielle. Appreciate you being here today.
all right, thank you.
Members, I'm going to send her flyer to you in your emails for the Soups On for Senior event. I'm going to try to attend if I can. Just want to make sure we draw your attention to that event. And now the Health Department. Kristen, how are you today?
I am good. Good today. I was debating as I was sitting there if I wanted to jump right into our regular monthly report or jump into the attachment that went with it, and I'm going to go with the attachment. A couple months ago, I started trying to put an attachment with the monthly report to try to kind of highlight some different things that were going on. There's so much data and charts and words in the monthly report that, you know, sometimes programming things get lost. I feel like they could get lost in there and overlooked, and I give a brief little blurb about most of them, but one of the things I wanted to start doing, and I thought this was a great opportunity, was to highlight not only, you know, a couple different things, but actually highlight a program. So I put this monthly highlight together based on some new data that had just been put together regarding lead, childhood lead testing, and our lead testing program. So on the first page of that, there's some information, background information about, you know, what lead poisoning is, why it matters, things like childhood speech problems, learning disabilities, things like that are being found. You know, we hear about lead a lot in other communities, but it's just as important of a concern here in Jackson. Basically, what our lead program here does is focus on the education and outreach, trying to inform not only the actual residents in the community about lead safety, but lead testing and the importance of that. And on the second page, I mentioned this is where this came from, was our lead health educator worked with state consultants who reviewed and put together the most recent lead information about lead testing. And you can see over the last year, or in 2020, lead dramatically decreased. And so they put this profile together really to send out information and target health professionals, schools, you know, people like me bringing this to you, you know, so we can educate and make sure that it's known that lead testing is important, funding is important for it. And a lot of that comes from kind of infrastructure, things like that we want to help advocate for and help promote. So there's a lot more information on this sheet here, but this will be, our health educator will be working with, you know, like I said, these different groups and areas to try to inform and educate and do outreach in order to increase testing. One of the things that is contrary to that, though, is in our Wic program. You probably heard me say that we weren't doing Wic testing because we have some problems with nationally getting the getting the lead tests. There's a shortage of the lead tests, so we're not actually doing any lead testing for our WIC children right now because we don't have access to the testing. So that, you know, we want to promote that, but we're kind of at a standstill too with the tests that we need to do that in-house, but.
Mr. Chair. Please, go ahead.
I was just, go
Yeah, let's, Commissioner Bear, go ahead, please, and then we'll get to Mike. And Ray?
You say you don't have access to the lead testing kits. Why is that?
From what I understand, Deborah, you might be able to give me more information or back me up on it. We do different lead testing. There's some sort of, whatever the manufacturer of the finger poke lead tests are not available. They can do lead testing, I think, within a lab and within doctor's office, but for our programming, we can't do that lead test.
So you say they're not available. I mean, we hear about trucking and not being able to get products delivered on time. Is this a problem resulting from
No, there was a recall on
transportation?
the.
Is the manufacturer not manufacturing these anymore?
I know there was a recall on them back in the fall, and I don't think the manufacturing has ramped up and resumed from that.
Okay,
it's
thank you.
a supply issue. It's not on our end, it's a supply issue. And we're just getting the information from other sources, so we just have to go, we haven't researched it ourselves. We're just getting the information from the state and other sources. So we're trusting what they tell us, but we aren't able to get them in supply. So there's a supply issue, not on our end.
Commissioner Snell, please.
Thank you, Mr. Chairman. I think it's important to note that if you buy a house that was built prior to 1978, you can assume there's lead paint in it. And the big thing, and you'll get a notice from the seller whether or not they know of any reports or if they know of any lead paint in the house. Well, since 78 or before, that house has probably changed hands several times. Rarely do I see anybody, and in fact, I don't think ever in 14 years of real estate have I seen anybody put, yes, I have a report, or yes, I know about it. The other thing, especially the kids in an older home, the reason they eat paint chips, lead is sweet. They like it. Lead was used to sweeten wines since Roman times. So if you have little kids in an older house, you want to be careful, especially and it's usually around windowsills and windows where the paint is chipping off.
I did not know that about it being sweet, but when putting this together, and this is one of the pictures that's on our website for the lead program, and I pulled it off there, and I was like, this child is eating the windowsill, but yeah. In most of the pictures, when you search childhood lead, it's that.
Mike has a question.
I was just going to ask, are we, you said we couldn't test because we don't have the test. Are we keeping track of who we didn't test, and can maybe we follow up later with the WIC people? Or because, you hate to miss an opportunity.
Yes. Because anyone that's currently still on WIC, we would, they have to come in yearly, or actually they have to come in biannually. Now they still have, and I'll mention this in my report, but they're still able to do remote appointments. But they still have to come in now that we can open. They still have to come either annually or biannually. So that would be caught at that. We also partner with are on Henry Ford's EPIC system. So if lead testing, they can check that and see if that's done. If it's been done elsewhere, it's not duplicated within our system. And on the other side of that, if we do a lead testing or anything like that, it shows up in their provider's office providing their Henry Ford provider.
Okay. Any other questions on the lead testing? We can ask Kristen to move on to the rest of her report.
Well, that ties in nicely with the first item that is on the report, is the WIC program, and since the last time I reported, there hasn't been a whole lot of changes, but again, I mentioned the remote appointments, those are still continuing to happen. We are finding that a lot of WIC mothers prefer to call in and do a remote appointment. And we are obligated to allow that remote appointment if they so choose until the federal guideline changed and they extended that. I am not sure the deadline on that. I think it's a couple more months, maybe out to May. We're in at July. But we are open. We do get people coming in and out of the WIC clinic. Going along with the lead shortage and the recall with that and our inability to do that, one of the big things that we're still seeing and continues is an infant formula shortage. I've heard several conversations and talks about the WIC clerks and dietitians working really hard to try to find formula. They've expanded the WIC department itself from the federal level, and state levels have expanded their offerings of what they'll allow. They'll also allow samples. If we have samples, we can give out samples. In normal times, we're not allowed to give out samples. So, but I am hearing, conversations where our staff is calling around Rite Aids and local farmers or local stores and, the big box stores to try and find formula for these kids. So. And they end up, to continue that, they end up, they thought they were good and would look online. You can shop just about everywhere online now. So they thought, oh, well, I found some at Rite Aid or I found some at Walgreens, and then we'd send a mother over there and they'd say, no, it wasn't there. So now they're calling every store to try to find out if they actually have it, and then saying, will you hold this for 10 minutes while this mom, comes over and gets it. So, moving on from WIC, our youth programming, health education programming is up and running and successfully completing courses with not only our 6th grade middle schools, we're looking into the 5th grade at Hunt and Cascades for our Empowering Youth program. We just hired, we had had our part-time health educator that worked in the Empowering Youth Today program resigned in November, and just this week we have a new health educator working, or going to start, I think she starts tomorrow, to come into that program, and we'll have more sessions of that going. There's also the BOSS, it's called BOSS, Built on Self-Success. It's an after-school program. They've had about 24 students in that program. That's about the max that we can take in that program, and they've been working diligently, learning things about, their strengths and weaknesses and how to, be reliable and accountable. And it's noted in here, one of the teachers is doing a really good job working with them as well and keeping them on task. The Teen Outreach and Teen Pregnancy Prevention. The Teen Advisory Council just recently changed their name. Interestingly, my daughter's on the Teen Advisory Council, and I saw a message come into her phone and it said DRIP, and I was like, what is DRIP? Why, and I'm thinking, almost immediately think negatively, because I'm trying to catch her in something, but it was not. She said that's the teen their teen pregnancy prevention program, and she said that it's developing responsibility in our peers. And so she was not into nefarious actions, but they have changed their name to this Developing Responsible Teens. They're working, I mentioned last month that the advisory council on that was set, and Sheriff Schutte actually presented to that group last month. They put a video together. I haven't seen the video yet. I'm interested in seeing the video that they're working on. SNAP Ed, we just finished with working with the Head Start programs in a couple different communities, talking about nutrition and teaching the kids about nutrition, not only teaching the kids but their parents as well, sending educational information about their parents, or back home to their parents. Lead, I'll skip over because we talked about that one. Hearing and Vision program, it is up, running. They're full scheduled in the schools 3 days a week for all hearing and vision needs on there. After that, there's a couple programs, there's a couple pictures from different programmings within the community, and then our monthly WIC report on there. I'm going to take a break for a second. And are there any questions about, that's kind of one division of the program, so any questions about that division before I move on to COVID?
Questions for Kristen? Not seeing any. Please
Okay.
proceed. Thank you.
So on the other side of the WIC health part is the prevention and personal and preventative services. Our sexual health and communicable disease program is up and running. It continues. One of the things to note on there is that, although we feel like we're on the downside of winter, hopefully, flu is still often most prevalent in February and March, so we are still promoting flu vaccines and encouraging anyone who hasn't got a flu vaccine to get a flu vaccine. Community health update, thing of note on there is the MIHP. The MIHP EMR was graciously approved by you all in December, and we have done a few orientations with that, and they are, it should be live and in action within the next couple weeks. Under COVID,
Can I ask, what is, I'm ashamed to say I don't know what this is, Campylobacter, is that a
it's some sort of,
foodborne illness of some sort?
yes.
It's under.
So it's a bacteria.
Is it? Okay, all right. I've heard of salmonella, I had not previously heard of that.
Yeah, I would say yes, that's a foodborne illness, because it's listed from that section, so that's the best I can say. I don't know what it's from or how it works or
I'll have to Google it, thank you.
any of those details. So on to COVID. COVID numbers, all of that data, all of those are in the next couple pages for you to peruse and ask questions as you like. We are starting to see, even from this report, that numbers are going down. I heard in the news this morning that Henry Ford Allegiance Health System, Henry Ford Health System as a whole is reporting a decrease of total hospitalized COVID patients from up near 400 to down to under 300 from last week to this week. And then one of the things that we continually hear is, at this point, instead of number of cases, that the way towards the end is the decreased number of hospitalizations. So, as we hopefully will see a continued trend of decreased hospitalizations, our numbers may still be high, but the hospitalizations and the deadliness will decrease. We are still doing booster clinics, first dose, second dose, and booster clinics as requested. I haven't heard of any recently since the last probably time I talked to you in January. We had a couple scheduled in the school districts. They had asked us to come in, but in the clinic they are still available on a walk-in basis and by appointment. One of the big things right now is the testing and the KN95 masks, and I'm sure you've seen that and heard of those. A couple different places to get tests. The schools and the health department, and I believe we worked with Danielle, got a couple thousand from the load from the state for the testing. No, you got masks. You got masks. Let me skip back then to the masks, since I brought Danielle into it. We received a couple truckloads of masks. The schools have been receiving masks. And I just printed off this morning, we just put together, because one of the questions we get asked a lot is, where are masks? Where can I get masks? Where can I get them? This was just posted on our Facebook page this morning. We just finalized this last week with different places and locations that KN95 masks are available, including Community Action Agency, Center for Family Health is not on here, Region 2. We are at the health department. We have 2 days a week that we're going to offer masks with help of our Spring Arbor University nursing students. They are going to be there and available to help hand out masks to anyone who comes in and wants them on Mondays or Thursdays. Now back to the testing. Testing clinics, we just started. Just last week, we put together a partnership with Center for Family Health and their Parkside Clinic for use of their clinic space to do testing, and the Pringle Fire Station with the City of Jackson, and opening up those testing for any student or staff within Jackson County schools, not just Jackson Public, although they're located in Jackson Public areas. any Jackson County student or staff can come do testing on, I believe they're trying to focus on Monday mornings to test before kids go back to school for the week. Testing for individuals is available. The federal government did covidtests.gov. You can get up to four tests. And there's a new grant from the Rockefeller Foundation that if you're in area codes 49201, 202, or 203, you can request a package of 5 tests.
Commissioner Beer has a question.
Thank you, Chairman. Testing, when someone has tested positive, they stay home or after the symptoms are gone, when do you retest them?
We don't.
You don't retest them?
No, the guidelines, and I apologize, I don't have the guidelines 100% in my memory, but it's to test on day 3 to 5 after symptoms develop, and then once your symptoms are waning and you don't have a fever anymore after day 10, there's no need to test. But we're not even quarantining after if you have no symptoms or fever.
Okay, so I'm glad to hear you're not retesting, because
The
the
health
information from CDC and from MIT says that you shouldn't test again for 90 days, because during that time period you get a lot
We're not
of...
testing at all. I think this is what Deborah was going to say. We're not testing at all or requiring testing at all. It is all of our information, if someone called and asked that question, would be what is recommended by, we would say what is recommended by the state.
So are
right now.
schools retesting?
The school, if they so chose to retest before the child came back, that would be up to the decision of the schools.
Okay, so the data shows that if you test within 90 days, you get a high percentage of false positives.
Yeah. And even, I know I just traveled a couple weeks ago and had to test before I came in, and one of my friends who tested with me, or went with me, had a positive COVID and had to have a letter from her doctor stating. So I don't know that it's normal practice to retest. We are not recommending that, though.
Thank you.
Okay, thank you.
All right.
Proceed.
The last thing that I have is just the environmental health update. Talking about their numbers closed out for the end of 2021 with higher levels of numbers, increased business activity. They even note that septic and well permits are higher than they've seen since 2007. So they were busy last year. Couple miscellaneous items on there. I mentioned before the Arbor Village Mobile Home Park. We are still assisting as a liaison for that kind of cohort to solve that problem there. I know Don just recently sent a letter to get an update on where they were with their permitting, and things are moving along with that. Last month was Radon Activity Month. Don had went on the Bart Holly Show to promote radon testing, and we have radon tests at the health department available for $5, in case you need to know.
I appreciate the information on Arbor Village. That's, I think it's been kind of a lingering problem out there. If you keep that on your report until there's a satisfactory
keep it there till
resolution
it's
there, yeah, that will help. Further questions for the health department? Mr. Chair.
I'd like to go back to your annual report on vision and hearing, if we could, please.
Yep.
Okay, so the way I read this, you screened 3,700 kids roughly, 578 of them tested poorly for hearing, or vision, excuse me. It says 16% were referred, so 16% of 578 kids, or 16% of 3,726 kids were referred? What's your number?
That's a good question.
Okay, then my next question on that would be receiving follow-up care. Is that 12% of the 16%, or is that 12% of 3,700, or 12% of 578?
I am going to get back with you on that.
Okay, I'm a big believer in total numbers because I have organizations, Lions Club, Disability Connections, many organizations that target these kids. And if the parents feel that they, for whatever reason, that they don't want to reach out to volunteers to help them provide proper eyewear or hearing wear for their children, these people will meet with them completely quiet through Disability Connections and make sure those kids are taken care of. It is vehemently important that we reach those kids early and get them started, because reading has to be handled by third grade now, because if you're not reading, there's a risk to be held back, according to the state of Michigan. And that would involve vision. I have a hearing impaired TC retired that lives with me and tells me constantly that I need to pay attention and hear. So I think it's important that we get our kids to hear early too. And I really would like to know those numbers, not percentages, please.
I actually am going to jump in and say that I just looked at this further, and I believe, because we have the number of children referred and the number of children screened and referred, and then the percentage of children referred, I don't have my calculator, but I believe that 16% is the 578.
And so 12% of 578 actually get help? Or 12% of the 3,700?
Probably of the 578, but I will verify that. I will say, one of the questions that I had asked early on was, that number just seems low, but that is the number that we have to refer, that our parents aren't. So if my daughter, I have health insurance, I have vision insurance,
Yeah.
I have everything. So if my child was sent, then I would sent home with a letter that said that, then I would go out on my own with my insurance and get that taken care of. So that number is low is not a bad thing. That means that that smaller percentage is what we actually need to help get assistance from, for instance, the places Chairman Schwab.
So you'll
But I'll
verify those
that
calculations and get back to us, if you would, please?
Do we follow up in a year on these kids, or do we just test them in second grade and they shall be on their own until they reach the age of majority?
I don't know that answer.
Okay. Thank you.
Further questions for the Health Department? Hearing none, thank you, Kristen, appreciate your being here
Thank
today. Moving on to other business, the claims should be passing around. I think everyone has seen them. Looking for a motion to pay the claims.
Move to approve.
Commissioner Williams, seconded by Commissioner Snell. Thank you. Any questions with respect to the claims? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. Appears to pass. Other minutes, I don't see any other minutes under our agenda. Committee members will please take note of the reporting schedule for next month. The Department on Aging, Health Department, and Lifeways. Lifeways was not prepared to make a report this month, and I gave them a pass. Now moving on to public comments. Are there any public comments? Any public comments? Hearing none, we'll move on to committee member comments. Any committee member comments? Commissioner Bear, please.
Sorry, I didn't think of this while Health Department was still presenting. If we can't get lead tested to determine whether kids are getting into it or not, a lot of pollutants, you can encapsulate it, make it non-accessible, so you cut down the incidence of poisoning people. If we've got people that we don't know whether their homes have lead paint, don't know if their kids are getting into it because we don't have testing, can we give them paint? Is lead a similar contaminant that you can paint over it, encapsulate it, and then the kids won't be getting into it? Can we do that as a stopgap measure till we can actually test it?
So I guess the question is whether doing something like that would mitigate the risk that we have. Maybe next month, Kristen, you could answer that question for us? Commissioner Snell, please.
Are you suggesting the government would mandate that you paint your windowsills? I'm kind of,
If painting would protect the children, then we can offer it as a voluntary application. Don't have to mandate it.
okay.
If you just let us know what the mitigation might be for lead paint, Kristen, that would help, okay? Any other committee member comments? Commissioner Williams, please.
And this is just for reference for the last comment. And this isn't necessarily a program that Jackson County has to do, but I do know of other counties, particularly Ingham County, as an example, that have programs in which if you have a rental property where kids are living there, that the county has measures to provide additional funds to get the paint either removed or painted over as a rebate program. So just throwing that out there, that there's some other counties that are doing some interesting things to do that. But there is a very strict policy, if you will, on that you have to qualify for as well. So that's just a reference to Commissioner Bear's comment. Thank you, Mr. Chair. Nothing
Thank
further.
you. Okay, Chair will entertain a motion of adjournment. Thank you, Commissioner Bear. Not debatable. Commissioner Williams supports. All those in favor will please say aye. Aye. Any opposed? Thank you. We are adjourned.